in this session, we're really going to be looking about how responses to the pandemic, locally, nationally, and internationally, have changed key aspects of humanitarian aid delivery and the functioning of the existing system. And we're very lucky today to have 4 leading figures from the humanitarian community. And as I introduced them just now, I would really encourage you to also introduce yourselves in the chat box. I've seen a lot of people have started this already, which is great. And if you can share your name and the name of the organization that you're working with or the initiative that you're part of, that would be super. So starting off, we have Daniel Walden, who is a specialist in community-based disaster risk management. He currently is focused on emergency planning and communication at Unicef UK. He has worked as a regional advisor across East Africa, supporting organizations across the region to engage communities and children in climate and disaster resilience planning. In the Philippines as part of the interagency response to Super Typhoon Haiyan, and in China, Denmark, and the UK to support policy and programs development for child resilience. Daniel led the coronavirus crisis response for UNICEF UK, so is very well placed to speak to the issues we're discussing today. Next, we'll be hearing from Meghann Rynard-Geil, who is Humanitarian Director at Internews. She's worked on monitoring, evaluation, research and learning, and as a technology for development advisor, focusing on ethical and accessible integration and use of ICT tools, particularly social media and messaging tools, for information sharing, feedback mechanisms, early warning systems, and communication with program participants. In the last 2 years, she has supported and led several initiatives to explore the nexus of digital myths and disinformation and humanitarian crises. Next, we will hear from Ndubisi Anyanwu, Mercy Corps' country director in Nigeria. He has held leadership roles across government, private sector, and development spheres, including with the World Bank in Washington, DC, as an advisor to Nigeria's finance minister, and as founding CEO of NOI Polls, Nigeria's first country-specific opinion polling company. Prior to joining Mercy Corps, Ndubisi's work with the Bill and Melinda Gates Foundation helped secure the Nigerian government's commitment of $5.3 million for vaccines. And speaking last, we have Rita Rhayem, who is the General Director of Caritas Lebanon. She has a diploma in hospital and clinical pharmacy and an MBA in health management, and she is a passionate worker in the humanitarian field. In 2011, she published her book, Accreditation of NGOs' Healthcare Centers, drawn from her experiences as head of the health department at Caritas Lebanon. And she's also currently pursuing her education in gender studies. So thank you so much to the participants that I've seen as sharing introductions. It's excellent to see so much interest and a wealth of varied perspectives with us today. I can anticipate that there will be some great questions and a lot of engagements, but we also have quite a tight time for today and a lot to hear from our 4 great speakers. So I would really encourage people to essentially save their questions from the end. As Catherine mentioned, do put them in the chat box and we will come back to them at the end, to as many as we have time for. But if we have the speakers first and then the questions for the end, that will leave us with the best opportunities for discussion. So on that note, I would then ask Daniel to start us off with the first presentation. Handing over to you now, Dan.
Thanks very much, Chrissie. I have remembered to unmute myself, so hopefully you can all hear me fine. If we jump to the first slide, and I will ask you kindly to shift along when I need to be shifted along. Thanks very much. Obviously, this is a very big question, and it's a global crisis with plenty to talk about. So it's very hard to distill everything that's happening in my day-to-day and in my head onto just a couple of slides in 5–10 minutes, but I'll do my level best. This is the Johns Hopkins map from just a couple of days ago, and it doesn't, it might be alarming. It's not as alarming as it was this time 6 months ago, as the dots started to be popping up across the world, and people started to be essentially watching the cases of coronavirus rise globally. We're now at something like 31 million cases, and I think we're approaching 1 million deaths. But for me, I think one of the primary things that is coming out on the back of the crisis is that it's in many ways reinforcing a lot of what we already know. A lot of existing vulnerabilities that those of us in this industry, if you want to call it that, work with every day with children and their families are being thrown into sharp relief by the fact that this is a very similar crisis worldwide, but the impacts of it are very, very different. Just like we've been saying here in the UK, we're all in the same sea, but the boats we're floating in are very, very differently equipped. And that's the same across the world. Some of the things we're seeing across sub-Saharan Africa, for example, are continued nutrition crises, and the pandemic and response to the pandemic has embedded a lot of those vulnerabilities related to nutrition crisis. Similarly, in Yemen, where we've seen the biggest cholera outbreak in history recently, and we're still battling cholera, along with a number of other health challenges, and where the health system is barely 50% working, we've now got another health challenge on top of that, and that's what we're focusing on at the moment, in particular around water and sanitation, as you might imagine. It's also worth remembering or considering, I think, that the international development humanitarian world has very, very often been working in kind of rural environments. We're very used to working in rural environments and hard to reach, if you like, communities. A lot of the cases of coronavirus are happening in the urban context, which is relatively new for us. And it changes the idea of what access is as well, particularly when we're talking about urban context, but everyone has to stay at home in one way or another. All that said, I think probably one of the most important lessons, if you like, for me, in the last 6 months or so has been, it's not necessarily about these red dots. It's not necessarily about the cases. The cases are one element to think about, but the impact is stretching far further than 31 million people who've been infected at current count. Billions of people have been affected by lockdown measures and public health measures, and that's something which that's what's been throwing up into sharp relief the vulnerabilities that they face every day. So that's the first thing, kind of reinforcing what we already know and thinking beyond the immediate cases. Cases aren't the same thing as impacts. On the next slide, this is, I think, indication of the need and the scale. This is where we're at in terms of the Unicef coronavirus appeal at the moment globally. It's obviously not a fundraising ask, but this is the kind of slide we take to our high-level donors when they ask us. But this is also for me something which speaks to the way we deliver emergency response, where the money goes, where the resources go, the people, and how we prioritize those things. At the beginning of this year, we had 3 level 3 emergencies, where level 3 is the biggest in the UNICEF kind of grades. Those were Yemen, Syria, and the Democratic Republic of the Congo. DRC is now down to level 2 for a number of reasons, including the Ebola crisis kind of decreasing a little. So we've now got Yemen and Syria, and coronavirus is a level 3 emergency. That normally means, right, get people on the ground, get attention on this crisis, and get all the money to that place. That's fine when it's Yemen and Syria. We can manage that quite well. When it's a global crisis affecting 188 countries, where to focus attention, funds, and resources is a really challenging one to think about. And we've had to be essentially working on the hoof with that across the global organization. The amount of information coming in has been incredible from country offices and regional offices through our emergency operations team in headquarters. And we've been really having to basically go day by day, week by week on how much funding have we got and where does it need to be sent now, essentially. Also on this map, you can see that Latin America, where we're seeing a lot of the cases at the moment, is not one of the higher needs in terms of funding and therefore in terms of kind of vulnerability. We're looking at the highest need in sub-Saharan Africa and Middle East, North Africa. So that's the one thing. Also, the access of humanitarians to getting the people to the right places, that's been scuppered by the whole lockdown working from home piece in the fundraising countries and the headquarters countries, but also in regional offices and country offices. this has done an amazing job of showing just how valuable working through partner organisations is. And we have, our work with partner organisations at Unicef has been kind of going up steadily, particularly in emergencies over the past years. And this is, if nothing else, vindicated that. The second point I would use this slide to make is, this is one crisis. At the beginning of the year, we have the Global Humanitarian Action for Children appeal that is released, and that has 60-something emergencies on it. The ones that no one is talking about are changing as a result of the coronavirus appeal. No one's spoken to me about South Sudan in months, despite the fact that it's still a difficult place to be for many children and families, because there's not so many cases of coronavirus there. So it's very hard to get people's attention and keep people's attention on the places where perhaps it might be needed. Right, we'll jump onto the next slide if that's okay. And this is a pondering that I have, which I've not yet quite articulated as well as I would like. This is yet another borderless crisis. It's not, borderless crises aren't new to us. We've got migration crises and refugee crises, as shown by the UNHCR map on the bottom left there, and we've had them for years. We've got incredible diversity in terms of climate vulnerability, as you can see in the top right. This, however, is a global borderless crisis, which has had impacts right up in our business. Everything has had to stop or be significantly restricted for almost everybody in the world. Now that's a really impressive movement, and I really want to see what happens next in terms of understanding and motivation of people and governments and the media and donors towards addressing borderless crises, in particular climate change. My background is disaster risk reduction and climate change adaptation, and that is another global crisis which is already happening, but it's relatively speaking slower onset, if you like. And as is typical with slow onset emergencies, we don't tend to look at them properly until it's too late. And I still don't think we're looking at climate change properly. What can we learn from this crisis to move on to the next, to progress our work on climate change adaptation and climate resilience? Finally, and final slide, I would be very keen for us all in our world of innovation and looking for something new and shiny, to remember that there's some things which we've been doing for years which are extremely effective. Unicef has been churning out bars of soap and clean water to people since the 40s. Hand washing is one of the most effective and simple ways of managing this crisis, and I cannot tell you how proud I am to be part of an organisation that has reached more than a third of the population of the planet with information on how to keep yourself safe from the virus, including washing your hands and staying well sanitized throughout the day. That's a simple and effective thing which isn't going to change, and it doesn't need to change. So whilst we look for lessons and we look to see how we can do things differently, we also need to keep the nuggets of gold that we've already got. I'll leave it there, and I'm happy to take questions, as said, a little bit later on. Thanks for having me.
Thank you. Thanks so much, Dan. Really interesting points, and I think particularly the sort of the impact rather than the number of cases and the borderless crises that we're facing in different areas. Thank you. Meghann from Internews is speaking next. Thank you.
Great, thanks, Catherine. Hi, everybody. And yeah, we can just go through to slide 19. Yep, that's fine. Thank you. So yeah, thanks for having everybody. As I think we've all been experiencing an interesting point in our lives. And I have been thinking a lot about how COVID-19 has or has not changed the humanitarian landscape. I mean, I think that we are seeing an increase and an exacerbation of many of the problems that we'd already been experiencing. But we also see opportunities here as well to begin really focusing on local partnerships, to really work with the communities that we have been operating in for many years, and to focus on communication with communities in a way that maybe we haven't in the past. So, I mean, we've probably been seeing a lot of this information. Something that Internews has been focusing on particularly throughout this pandemic is the infodemic, which WHO named in February, right around the time they announced COVID was a pandemic. So we've been responding to rumors and mis and disinformation about COVID around the globe. We're currently responding in about 7 countries as a humanitarian team, really trying to make sure that accurate information is available to the communities that we're working in, but that it's also available in the languages that they speak, on the platforms that they use and trust, and via the local sources that they use and trust as well, so that the information is as contextually relevant and useful to them as possible. So I think one of the biggest things that we've been really trying to work against is rumors about the spread and how to treat current COVID. And especially now, as we're starting to see cases go down in some areas of the world, we're now beginning to see rumors that people don't think that COVID exists anymore, or that it never existed. And so we're really working on trying to keep the public educated about what's happening around the rest of the world and how to prevent the spread within their communities. The massive amounts of mis and disinformation that we have seen just exponentially rise across the globe around this, I think has again exacerbated the need to understand how to respond to mis and disinformation. And so we've also been working with local communities and regionally as well, with media and journalists, to begin to think about how can we present messages that not only refute the mis and disinformation, but actually respond to the needs within the communities as well. We can go to the next slide, Catherine. So one of the things that Internews really focuses on is what a good information ecosystem actually looks like. And so we're really trying to create now a global information ecosystem that's as healthy as local ones that we're trying to operate in. So we focus on, number one, providing good information, but also making sure that there is safe access to that information so that vulnerable populations have access to it. And they're not being left out as a lot of this response moves into a digital world. So one of the things we've had to be most sensitive of is that because we're all working remotely, many of the communication campaigns and information sharing campaigns have moved online to social media platforms or to SMS. And so we really have to be careful to make sure that we're still reaching people who are on the other side of the digital divide. We also really think about critical assessment. So how can we help the audiences that we're working with understand how to critically assess the information that they're receiving? So we want to make sure that they're able on their own to identify and piece together correct information about the pandemic. We also really want to think about accountable institutions, particularly in this crisis. So making sure that we are communicating back with humanitarian organizations, health actors, and government actors about what we're hearing from the communities around how people are responding, how stakeholders are responding to the COVID response, and what the needs actually are, so that we can be very flexible in our response and try to get these communities what they need. Catherine, we can move to the next slide. So yeah, one of the things that in order to do that, we really do try to aim for reaching the most vulnerable communities and to amplify their voices within this response. So we focus on community engagement and two-way communication. We're doing that directly with the vulnerable communities by reaching out to them via social media platforms, and now especially via local partners, so that we're still getting some of that face-to-face contact if possible. We're also rumor tracking and then sharing that information with local health and humanitarian media and government stakeholders so that they can inform their responses based on the rumors that we're hearing. We're also really thinking about stakeholder engagement. So how can we help stakeholders get closer to the communities that they're working in and really understand what the needs are? Right now, as I mentioned, we're responding in over 7 countries. We've reached over 4 million people with information around the COVID response. And we really are looking at kind of connecting the local and the global. So when we learn something in a local response, we ladder that up to share that with our humanitarian and health communities at the global and the regional level as well, so that it's kind of a hub and spoke model of information sharing, and we're ideally able to share lessons learned and not reinvent the wheel over and over again, as we're all kind of dealing with the need to be creative around our responses. Catherine, we can go to the next slide. So in terms of thinking about what we're facing that's different, I think the obvious is that we are now in a remote situation where maybe we hadn't been before, which in some ways makes it even more difficult to reach those populations that already were quite vulnerable and isolated. And so we're having to really, really focus on increasing local partnerships, making sure that we are accessing those vulnerable populations and identifying their needs and not letting them get left behind in a digital response, which I think actually presents an opportunity to really expand our local reach and local partnerships. We are also seeing a lot of peripheral challenges kind of popping up as energy is spent on the COVID-19 response. That same energy is no longer being spent on other responses. So we might see more stressed health systems. We might see a decrease in work on HIV and AIDS, maternal health and nutrition. So we really want to make sure that we are not decreasing our information sharing or our other work around those areas as we increase our work in COVID. Otherwise, we'll see an increase in those diseases as well. We're also seeing, I think, in our own lives, even how do we respond with education? So how are we making sure that people's and youth's education is not interrupted too terribly during this response, especially for children that are not able to access connectivity and remote learning? I think we're going to see a very, very significant economic response required for recovery from this, and a lot of creativity around that. And so one of the things that we're beginning to think about is how can we be sharing information about economic recovery solutions that are applicable for the communities that we serve. Another area that we're seeing an increase in is gender-based violence and protection challenges. And so we're really trying to think creatively around that. How do we make sure that vulnerable people have access to those services so that they can get the help they need and that they can remain safe as possible during this time? I think that mis and disinformation is an obvious one, but it's come to the fore in a way I think that maybe it hadn't in the past. So we all knew that mis and disinformation was an issue, but now it's a global epidemic, and we're really seeing a lot of energy that we've not seen before from many organizations to respond to it, but also to understand how best to respond to it, because it's not just simply sharing the facts, it's understanding why do certain rumors take hold within communities, and how do you actively fight those and build the trust within the communities to be sharing that accurate information and to have it take hold as strongly as the rumors and mis and disinformation. So we are seeing a lot of increased energy around responding to that, which we're very excited about because that's what we work on. So yeah, I think overall, just in thinking of this new landscape, we're trying to really be aware about what's next. How can we respond to the next pandemic? How can we start to build resilience within our communities to better identify information and to also identify trusted sources of information so that we're kind of looking towards early recovery and response from this current pandemic. Thanks, Catherine.
Thank you. Thanks so much, Meghann. That was really, really helpful. Introduction, a solid introduction in a short space of time to infodemic and that crucial aspect of COVID-19. We're running slightly behind time, so I would just encourage everybody to keep it tight. But really, really looking forward to our last two presentations, the first of which is from Ndubisi from Mercy Corps. Thank you.
Thank you, Catherine. Pleasure to be here. So let me just start by asking the question, which was asked to all of us, how has COVID-19 changed the humanitarian landscape? So the simple and obvious answer will be yes, okay? But the question is how? So I think first and foremost, there's the issue of donor funding, which Daniel had referred to earlier. Donor funding capacity has significantly reduced, and this is reflecting in the downturn of the economies of the major donor countries. Donor focus has also shifted midstream, with donors requesting adaptations of existing programs to COVID-19 programs. So we're seeing this as well in Mercy Corps, Nigeria, with shifts in programming to areas like wash and sanitation, as well as with nutrition. If we can move to the next slide. Okay, So I've spoken about the issue of donor funding. There's also the issue of program operations in terms of the changing landscape. So from the supply side, of course, we have experienced logistical challenges in Nigeria as a result of the various phases of lockdown that we've gone through, and the government restrictions, with the health challenges, the travel restrictions, and the whole global panic that we're seeing. But I think we are seeing this with many of our critical humanitarian interventions, such as food distributions and water trucking in the northeast part of the country. So this is an area where we have experienced change as well. I think the next area is the impact on thematic areas. So when you think of the COVID-19 situation, we tend to view it through just the health lens, which is quite, of course, very important. But beyond the health lens, there's also the economic angle, particularly in a country like Nigeria and many African countries where, at least in Nigeria, where 40% of the workforce is largely informal. But again, beyond the health and beyond the economic angles, there's something that we're not talking about, and that has to do with conflict, particularly in parts of the north central part of Nigeria. No one is speaking about the issue of conflict and how the pandemic is affecting relationships between conflicting communities. For instance, the high suspicion of the disease is disrupting many of our mediation programs, which we are no longer meeting due to the pandemic. We have a community program for peace, which is funded by USA to promote peace. And we're finding it difficult with respect to the farmer-herder crisis to be able to meet to de-escalate many of these issues that are escalating. So, for example, the restrictions on movement to mitigate COVID-19 have meant that the herders who regularly move from place to place in search of water are no longer able to move. And so this has led to a spike in attacks, particularly with the accompanying narrative that people are here to spread COVID-19 as being used as a justification. So like my earlier speaker had mentioned, again, it's this issue of disinformation and this room for banditry and so forth. So again, we can see how the restrictions have changed the COVID situation in these thematic areas. And then there's the issue of course, program implementation. So on the demand side, the program implementation is perhaps the most directly impacted by the COVID situation. Perhaps we can go to the next slide, please. So I've put some pictures up here, and these pictures in more than 1,000 words show how we have adapted the programming in some basic ways. I mean, on the left side, you can see the pre-COVID situation. These post-COVID pictures on the right side, they show the food distribution work that we do here in Nigeria, the learning work, the hygiene activities. You can see we're engaging in social and physical distancing. But the impact of the COVID situation has increased the time, the human, and the financial resources that we need to deliver. I think there's a picture with a young girl at the bottom there, and she's a participant in one of our programs called Engine, which is a UK funded program which aims to educate young adolescent girls. And usually we bring them together, but you can see there she has a radio, and we're transmitting the learning through the radio there. So these are ways that we have adapted, and these also come with cost as well. Next slide, please. So I want to leave you with some of these questions, as we think about the humanitarian landscape going forward. So the questions are, can we go back to the way things were? And even if we could, should we go back? Okay, and even if it makes sense to, would we ever go back to the way things were? So just want to get you thinking, and perhaps we can talk about this more. Thank you.
Thank you so much, Ndubisi. Really interesting, and I think great to help us emphasize that this pandemic is really one that stretches way beyond the health field. So thank you so much for those thoughts and for the questions. So our last presentation from Rita Rhayem from Lebanon. Thank you, Rita.
Thank you. Hi, everyone. So COVID-19 and the new humanitarian landscape. Well, if we move to the slide number 34, actually in Lebanon, we're facing a multitude of crises that are intertwined in a very complex way. We're facing economic crisis, so our currency has lost more than 70% of its values, where a huge number of people have been laid off their jobs. We then face a COVID crisis, where the lockdown has negatively impacted the economic crisis. We had faced Beirut blast on August 4th, and definitely we shouldn't forget that there's an important number of Syrian refugees living in Lebanon and an important number of migrants as well that needs assistance. So we're in a very complex situation where it is a protracted crisis and a multi-layer of crisis where sometimes COVID wasn't a priority for us. However, if we're gonna look at the humanitarian assistance from a COVID perspective, and if we move to the next slide, the first thing is that protect the beneficiaries. And by protecting the beneficiaries, it means that when there's a food or any types of assistance, an additional funds are required to make sure that we're completely sanitizing everything to avoid spreading the virus. Moving to the second slide as well, it means that our assistance needs to be changed. So we have to move from a total distribution to a door-to-door distribution, especially for people who are elderly, who have many types of diseases that can be at risk if they go out of their places, which means that here the distributions that will probably have been done in 2 days is going to last for a longer time. And as Daniel has mentioned as well, we're moving from rural to urban crisis as well. In addition, it means that food distribution, and if you can see the photo on your right, food distribution with our youth volunteering with us is a very long-term process, because from every door, from every home that we're gonna visit, we're gonna use all the sanitations requirement, all the PPEs requirement, and which means that the pace of distribution is getting slower. If we move to this next slide, it means COVID is not only protecting the beneficiaries, it's as well protecting the team and the volunteers. And with that, an important logistics and an important funds should be allocated to purchase PPEs, to train our youth and our team on the use of PPEs and how to protect themselves and their families. Because we are witnessing many of the services or the activities that have been put on hold because one of our team members have been impacted by COVID. Next slide, please. Unfortunately, August 4th, Beirut blast happened. And to tell you the truth, from August 4th till 2 to 3 weeks, COVID-19 wasn't a priority for us. Yes, we were wearing masks, but the priority was to secure the people who were severely impacted by the blast. And this is where COVID-19 has put an additional layers and an additional burdens on our assistance. We need to deploy quickly to be able to help the people in need. By deploying quickly, it means that we should be all ready with all our equipment. By deploying quickly, we should take into consideration that the silos of wheat have been totally destructed in our country, and then the food intake has decreased, which will put us as well in a risk of contracting COVID due to the immunosuppression. By moving quickly, we should as well take into consideration that there are many houses who lost the ability of getting water, who lost their shelters. 300,000 people, individuals who lost their shelters. So what are the risks of COVID? And by moving quickly as well, we noted that yes, 6 major hospitals have been severely hit in the country, but those hospitals are basically university hospitals receiving and taking care of COVID patients. So a crisis happening in a COVID context is a very difficult one to manage. For the next slide, we ask what happened, what will happen differently. Definitely technologies is now an important part of our humanitarian assistance. And today the webinar is a perfect example how technologies is taking an important place in humanitarian assistance. We used to send SMS messages for people to collect the services or to collect food distribution. Now we're sending those types of messages to make sure that we're doing the physical distancing. People are asked and invited to attend the services, but we're now separating physical distancing, using the SMS to inform them at what time they should take the or they should be present in our offices. Telemedicine, mental health sessions now, which are very important now after the trauma, are done online and remotely. Looking at the fundraising, everyone has been talking from today about the fundraising moving to online, but as well as the fundraising needed for the PPEs to secure and to help the humanitarian workers. It is the perfect time to look at the localization and to say that yes, it is important, especially now we cannot travel anymore. So what about the national organizations, the civil organizations who are at the grassroots, and they are now more than ever important in responding to COVID, in stopping the spread of the false rumors, in awareness sessions. The concept of assistance. Yes, we're working remotely, but we shouldn't forget that we're humanitarian workers. So the face-to-face is important. Being there with the grassroots at the level of community, hearing them is sometimes more important than delivering the services. What about new actors? Now we're talking about online education. Not everyone has access to the online education tools. So new actors are important, like probably private firms who are going to join us. What about the collaboration on international level? So I guess to sum it up, definitely COVID has impacted the humanitarian landscape. The question will remain, for how long? Is this a permanent or a temporary impact? And are we still at the early phase to assess the impact or no? Thank you.
Thank you so much, Rita. That was so interesting. Now, we have run over a bit in terms of our original schedule. And I just wanted to check. So far, I have a couple of questions. And has anybody else, if anyone else has a very burning question, please drop it in the chat now. But maybe I can ask to start with Kirsty Smith from CBM had a question about inclusive approaches. And I was wondering if maybe Dan and then also Ndubisi would like to respond to that one. Kirsty, would you like to unmute yourself and ask it?
Sure. Thanks very much, Chrissie. So I'm keen to know to what extent UNICEF ensures that the vital approaches that you were talking about staying safe in COVID response are inclusive of people with disabilities and older people who are traditionally excluded from mainstream humanitarian response and also from most WASH activities. So how has UNICEF ensured that their implementation is inclusive of traditionally marginalised groups?
Thanks very much for your question. I think from my seat in London, looking at the global response, I don't think I can give you a country-specific example, but I can say that a lot of the work that we're doing in specific country contexts will be working within the usual program strategy, and the program strategies will have methods for reaching people with disabilities. One of the really important parts of our coronavirus response activities, which doesn't get spoken about very much, is collecting data on the impact of the crisis on vulnerable groups, including people with disabilities. And I think we've been working with Washington Group for the last few years to build in disaggregated data into our country programs in the multiple indicator cluster survey and other kind of planning tools that should be informing the data collection that we're doing as part of this response. And then in country specific contexts, we'll be looking at how to get information out in the right channels and the right medium to people who need it. That is also definitely going to be through our partner organizations. The partners who we work with will be the ones largely who are in direct contact with communities under our country strategic plan in each different area. So the different partnerships will be guided by the type of vulnerability and also therefore the type of disability or the groups that we're targeting. Obviously, we exist for children, for every child, but that doesn't exclude more elderly people from our country strategic plans, and it doesn't exclude, for example, mums and vulnerable families either. That's not the best answer, but I hopefully it's a good enough one for the time being. And if you want to message me afterwards, we can always dig a little deeper.
Thank you so much, Dan. So in fact, I take the chair's prerogative to combine questions given the time. I hope you don't mind. Meghann, there were two questions for you. So one was from Tim Steele. Going back to your presentation about helping people critically assess information, it was asking, how do you do that? How do you help people to critically assess the information they receive? And another one from Kevin, who wanted to hear more about the risks of mis and disinformation. So maybe if you could answer both of those together. And my apologies to Tim and Kevin for not passing the floor. I'm trying to squeeze as much out of our speakers as we can in the remaining minutes.
Sure, and I'm happy to follow up with both of you individually as well. But those are interrelated. So I think to the mis and disinformation question, which also feeds into how do we help people critically assess their information environment. The first thing we do when we enter an information context is we do an information ecosystem assessment to better understand the dynamics on the ground. So the way that information is understood is incredibly social. It's completely colored by by your context. So by any tensions that are happening, any political challenges that are happening, any other ethnic type of conflict, or the entire social environment that you operate in. And so you have to understand how those information dynamics and how those social dynamics are affecting the messages that you send. So very specifically with COVID, what we've seen, and often with health crises, is that it's incredibly politicized. So there can be disbelief that COVID even exists, or if it is, that it might only affect certain types of people. There can be hesitancy to take treatment or vaccinations because people are worried that that is actually a conspiracy from the government or from any people in power to keep down marginalized groups. So it's very important to kind of understand the social dynamics around how a health crisis is going to be understood on the ground before we can start building an information response that will actually work. It's also really important to understand the other competing needs that people have. So the examples that Rita brought up are excellent. You know, if people are worried about where they're sleeping that night, being able to think about masks and PPE is going to get put down to kind of a second level priority. And so the way that we deliver information has to be responsive to what's happening on the ground at the time. And that in itself can help people kind of receive the information and put it to use better, because it's provided to them in a way that's accessible to their circumstances. In terms of responding to or helping to build people's capacity to critically assess information, we do many different types of capacity building training, again, built upon that information ecosystem assessment and the needs and the types of mis and disinformation that we're seeing. But very generally, we help people understand how to check sources, how to look at multiple different types of sources for their information. We help them understand what are trusted sources. So how do you identify what a trusted source is or should be? And to ask critical questions. We also work with local media and journalists to better understand how they can report accurately on health crises, particularly how to report on data and statistics, how to report on potential treatment, and again, also how to better understand those kind of dynamics on the ground that might be affecting how people are receiving information. So that's it in a nutshell. And yeah, happy to follow up with any of you after this as well.
Thank you so much, Meghann. Now, I see there are some super interesting questions on conflict coming in for Ndubisi, but I just wanted to take the opportunity and use my chair's prerogative to turn over to Rita, because there was that related point, which I think is so relevant, about how those local partners and those local relationships on the ground can be so valuable in countering these issues of misinformation. And would love to hear from her quickly with her perspectives on that. Thank you, Rita.
Thank you. Definitely, local actors who are really close to the community, who knows exactly to use the language of the community, are really important actors to spread the true and right information about COVID, especially when it is in a country of multiple crises where people are mentally overburdened and they need a source where they can count on. They need a source where they know that those information are right, and they don't have to go to make sure that those information to fact check. They don't have time. People are in a traumatized country. We're facing different crises. So the fact that there's a source that we can count on is something really important for us. So I guess this is for the information. I don't know if there's any other question about localization.
I think your point about sort of the lack of time and using those already built trust-based relationships answers a great deal of the localization issue. And thank you so much. So a last question, and again, my apologies, there's no time to share too much with others, but there was a great question from Jenny Chinembiri to Ndubisi about how do you think conflict can be tackled in this new landscape? And I think there were a number of other comments that were very interested in that perspective that you shared in your presentation, Ndubisi. So some comments from you to finish us off in a way, as we're on borrowed time on that, would be wonderful.
Thank you so much. Yeah, I think there was something else that came up also. You know, there was a question about whether we are in the post-COVID era. Well, I think from the Nigeria perspective and many other countries in Africa, I think this is the new normal at this time. The decision to open up the economy, I think this was largely based on the need for people to continue their livelihoods and to survive. And so we're quite resilient in this part of the world. You know, on the issues of conflict, I have talked about how in the north central part of the country that we have had issues of conflict because of mediation efforts that we have not been able to fulfill, but that's changing now. But I think economic issues are also quite key. You know, you look at the price of food and rising food prices and commodities, these have all gone up. Just for an example, I think a 50 kg bag of rice was selling for the equivalent of about 29 pounds before the COVID situation, and post-COVID, we're having a situation where the same bag of rice is costing about 52 pounds. So you can see that, you know, with the economic situation, with the issues of community relations, there always is that spark of conflict. So we'll watch and see how it goes.
Still muted. Thank you so much, Ndubisi. That's really helpful and really interesting. And I feel that we have raced up to the deadline with this session because there's been so much more to say than we've had time. But thank you so much to our 4 fantastic speakers and to all the participants for the great energy and chat that has come through and the super questions. I'm so sorry we didn't have time for more. What we need to do now is to move to the plenary so that a big chunk of people don't end up being late for that. But I encourage you all to continue the discussions. There's the Google Doc, there's the discussion thread, and the Alliance, I know, will be continuing these exchanges as a key part of its whole kind of network ethos for us all to have chances to learn from each other. and about these new developments in our sector. So thank you all so much, and to the Alliance staff for their fantastic and seamless tech support. And I look forward to seeing you in the plenary as we move over just now. Thanks so much.